Hi you guys, welcome back to my channel. My name is Sharday, and if you are new here, I create content related to nursing school, motivation, self-care, lifestyle, all of those good things. So if those things interest you, then go ahead and hit subscribe, like this video, and leave me a comment. Okay, so yes, today's video is going to be on my first virtual simulation. Okay, so I honestly did not know how this semester was going to go with it being a pandemic and all. And so what they've decided to do is they've decided to do these virtual simulations. What a virtual simulation is, you're basically getting a patient and you're given their chart, you're given what their pre-existing conditions are, you're given what, the situation is, blah, blah, blah. We're also given an S-bar communication format, and that's just the situation, the background of the patient, the assessment, and the recommendation from another healthcare professional. So I got my S-bar. My patient, he had coronary artery disease, he had diabetes, he was a chronic smoker for like 30 plus years. And he lived a sedentary lifestyle, which means that he wasn't active. He, just, sat around all day. So, this puts that person at risk for a lot of things. So my patient was in the hospital for a stroke. So my S-bar had given me the situation. It had given me the background of my patient, of his lifestyle and things like that. His race, his age group, all of these risk factor things. It also gave me, what I want you to do is I want you to do a head-to-toe assessment on this patient, and I want you to focus on the neurological assessment of the patient. And I also want you to, the order also says NPO, except for medications, and educate the patient on risk for aspiration and safety. So that was my focus for this patient. So I go in, I listen to this patient. So I click. So it's like step by step. So I go in, I'm the nurse. I click, I wash my hands, I introduce myself, I verify the patient and the date of birth. I do my head-to-toe assessment, all of those things. So now when it's time to do my medications for my patient, because mind you, he is diabetic, so he needs his insulin. He's on IV because he's nothing by mouth and all of these things. So I have to click, I have to view my medication. I have to compare my medications to my MAR, and then I administer the medication. Well, my patient started choking. So, and in my assessment, he had left-sided weakness. So my patient started choking. I'm like, okay. So then I had to notify my provider. There's buttons for all of this stuff. I had to notify my provider, and he's just like, okay, well, hold the medications. I'll update the order. So I go to look at the order, it just says NPO. So now I can't give my patient the medication. So now I'm confused at this point, because I'm like, I just can't not give this patient any of his medications. Like, when do you plan on coming to see this patient to assess? Like, what are we doing? Like, I know I'm supposed to collaborate with the speech pathologist and all this other stuff. So I'm like, okay, what do I do? There was no other button for what to do. So I just go ahead and I gave him the IV, and I finished on with my assessment, and I educate the patient on safety. I asked the patient, do they have any questions for me? And this patient is responding to me. And then I didn't see, because it gives you a list of what to educate your patient on, and I did not see risk for aspiration. So I just picked the one that said for coughing, because I figured, okay, well, if you're coughing with drinks and things like that, then you need to let us know so that way we can assess, blah, blah, blah. No. So after I'm done with everything, mind you, I did not feel well when I was taking this. I was having tooth pain, just was not feeling well. Like they said that it was supposed to take like a minimum of 4 hours to complete, but honestly, I could have gotten it done in less time, but it honestly took me like the whole day damn near, because I was like, okay, I did my patient, I'm talking in between, I'm taking a 2-hour nap here and there, like, okay, whatever. So then after I'm finished with my patient, I timed out, right? I think I timed out at like 40 minutes. So I failed. I got like a 68% on it or something like that, because the first time I introduced myself and then washed my hands, when I was supposed to wash my hands and then introduce myself. And then I also did not educate the patient on aspiration because I didn't see that option. But then, after reading further into the details, because I'm like, okay, I looked for, aspiration for in the education aspect. Okay, long story short, I redo the whole thing. I got 100%. So now I have to take this post simulation quiz, and I have to get a 90 or above on it, right, to get graded. Then I have to go and document all of the stuff that I did. So we have this thing called DocuCare, and what it is for students to have the simulation and the realistic practice of what it is to chart, right? So I had to put this patient's date of birth, had to put the name, I had to put the intake and output for this patient. I had to do the S-bar, my personal S-bar for this patient for the following nurse to assess. And what I had said was, this patient started choking with the medications. I notified the provider. Provider said strictly NPO. We'll follow up with until further labs and tests can be done and further collaboration can happen. So monitor this patient. Patient is diabetic, because if he's strictly NPO, that means that he's not getting any nutrients, he's not getting the carbs that he needs, he's not getting his insulin, because we're not going to give him insulin if he's not eating. So that's what confused me, because I'm like, so anyways, we had to put all this in the chart, submit that. Then we had to go and write a paper on our experience. So I had to reflect on if I liked it or not. I was like, how do you feel like it went? I felt like I was a little confused because I couldn't do any further interventions for this patient. I felt like the education was very minimal for this patient. This patient is a smoker. This patient has coronary artery disease. He's a newly stroke patient, so his life is going to be different for a little while. I didn't get to collaborate with any type of physical therapist, any type of speech pathologist, and the doctor gave me a half-ass answer. So yeah, so that was my reflection. So then I also put what was another question that I had asked? I had to pick 3 primary nursing diagnoses for this patient. So I ended up picking risk for aspiration, because he's clearly choking with anything that I gave him. Risk for aspiration, risk for falls, and knowledge deficit. So I did risk for aspiration because I did that as my primary, because the following nurse had felt like that was a really important thing to assess and put emphasis on, and everybody had asked that I put emphasis on the education for that patient, because clearly it's an issue. So I put that as primary, and that could kill the patient first before knowledge deficit and falling. So I put that on there as my primary. Then I think I put knowledge deficit as my secondary diagnosis. I'm not sure, but I know that safety was an issue. Oh, and then it said, how would you do things differently? So I had said I would have liked to do more therapeutic communication with this patient, because this patient is a new stroke patient, and he needs a lot of education on what it is to have a stroke, how did the stroke occur, why he's at risk for strokes and further strokes, because he's smoking, he has coronary artery disease, his vessels are constricted in some type of way with plaque or whatever the case may be. The plaque can travel up to his brain, just all this other stuff. He's a diabetic. He could be, like hypertension, poor circulation. With him being, he's lived a sedentary lifestyle. So I'm sure he's going to be even more sedentary because of the stroke, because he's having left-sided weakness. So it's good. We need to get this patient active. We need to come up with a plan to get this patient active, to prevent aspiration pneumonia, to help him strengthen his weak side, his left side. to prevent skin breakdown, to the smoking. We need to get him on a plan to get on stop his smoking. Like, there were so many things that this patient needed education on, and they had put a really big emphasis on his cognitive abilities. When I had assessed him, well, the nurse before me who had assessed him, she said that his LOC was ×3. When I had assessed him, his LOC was ×4. So, you know, he's doing pretty good for his situation, but it can get worse. And this patient can be back in this hospital within the next 30 to 60 days. You know what I'm saying? So I felt like the education was very minimal on my part on what was required of me and what my time was. And I felt like with this simulation, like, yeah, I kind of understood what was going on, but I feel like an actual person, I could have actually done that a little bit better, and then had the you know, my instructor reflect a little bit more rather than a paper kind of format. So anyways, I did get my grade back, and it wasn't even for a grade, y'all. This took me so many hours. It was for 0 points. It's literally just for my clinical hours, so, which is required to graduate and become a nurse. So yeah, that's how the virtual simulation went. It wasn't as bad as I thought it would be. Now that I kind of know what I'm doing, at first I'm like, what the hell am I doing? Like, but yeah, other than that, it was good. It was a good experience. Kind of confusing because it's a virtual patient, and you know, you're limited in what you can click, and you got to search on what to say, because it's literally documenting everything that you say in the order that you say it. And if you do it in the wrong order, then, you know. But anyways, that was my pandemic clinical experience. So if you guys have any questions on how that went, clearly right now the pandemic seems to be lifting up a little bit, so I'm not sure if for further programs they're going to be continuing on with this kind of teaching method. But just let me know how you guys you know, how you guys feel about this. And you know, if there are any other nursing students who have done any type of virtual clinical experience, let me know how it was. Let me know your tips on, you know, how to be the best virtual nurse. And I look forward to doing some more content for you guys, and literally sharing my experiences as they're happening. I know that a lot of people may share their experience, but in kind of the totality of it all. But I really want to take you guys with me during this journey in becoming a nurse. So like this video if you liked, or if you're even interested in more videos like this, and leave me a comment down below. And I will see you guys later. And of course, be blessed, be bossed up. You know, get to your goals, get to your dreams, do what you have to do to make it happen. And I will see you guys in the next video.